The removal of impacted wisdom teeth is a serious surgical procedure. Post-operative care is very important. Unnecessary pain and the complications of infection and swelling can be minimized if the instructions are followed carefully. Hopefully, you're resting comfortably at home. You should have a care packet which was given to you in the office. In it are some gauze, a syringe, ice pack, and a chapstick. Your folder also has detailed instructions, including a nutrition after oral surgery sheet.
The gauze pad placed over the surgical area should be kept in place for a minimum of 1/2 hour. After this time, the gauze pad should be removed and discarded. Vigorous mouth rinsing or touching the wounded areas following surgery should be avoided. This may initiate bleeding by causing the blood clot that has formed to become dislodged. Take the prescribed pain medications as soon as you begin to feel discomfort. This will usually coincide with the local anesthetic becoming diminished. Restrict your activities the day of surgery and resume normal activity when you feel comfortable. Place ice packs to the sides of your face where surgery was performed. 15 minutes on and 15 minutes off is suggested.
A certain amount of bleeding is to be expected following surgery. Slight bleeding, oozing, or redness in the saliva is not uncommon. Excessive bleeding may be controlled by first wiping any old clots from your mouth, then placing a gauze pad over the area and biting firmly for 45 minutes to an hour. Repeat if necessary. If bleeding continues, bite on a moistened tea bag for 30 minutes. The tannic acids in the tea bag helps form a clot by contracting bleeding vessels. To minimize further bleeding, do not become excited, sit upright, and avoid exercise. If bleeding does not subside, call for further instructions.
The swelling that is normally expected is usually proportional to the surgery involved. Swelling around the mouth, cheeks, eyes, and sides of the face is not uncommon. This is the body's normal reaction to surgery and eventual repair. The swelling will not become apparent until the day following surgery and will not reach its maximum until 2 to 3 days post-operatively. However, the swelling may be minimized by the immediate use of ice packs. The ice pack that you were given, or frozen bag containing peas or other vegetables, should be applied to the sides of the face where surgery was performed. The ice pack should be left on continuously while you are awake. After 36 hours, ice has no beneficial effect. If swelling or jaw stiffness has persisted for several days, there is no cause for alarm. This is a normal reaction to surgery. 36 hours following surgery, the application of moist heat to the sides of the face is beneficial in reducing the size of the swelling.
For moderate pain, one of the prescription strength ibuprofen, Motrin, or Advil 600 mg tablets may be taken every 6 hours. You may want to do this every 6 hours around the clock for the first 3 days. Thereafter, every 6 hours as needed. The anti-inflammatory properties of ibuprofen are also used in reducing post-op swelling. For severe pain, take the tablets prescribed as directed. The prescribed pain medicine will make you groggy and will slow down your reflexes. Do not drive an automobile or work around machinery. Avoid alcoholic beverages. Pain or discomfort following surgery should subside more and more every day. If pain persists, it may require attention and you should call our office.
After general anesthetic or IV sedation, liquids should be initially taken. Do not use straws. Drink from a glass. The sucking motion can cause bleeding by dislodging the blood clot. You may eat anything soft by chewing away from the surgical site. High-calorie, high-protein shake is very important. Refer to the nutrition after oral surgery insert that you were given on suggested diet instructions. Nourishment should be taken regularly. You should prevent dehydration by taking fluids regularly. Your fluid intake will be limited for the first few days. You should compensate for this by increasing your fluid intake. At least 5 to 6 glasses of liquid should be taken daily. Try not to miss a single meal. You will feel better, have more strength, less discomfort, and heal faster if you continue to eat. Caution: if you suddenly sit up or stand from a lying position, you may become dizzy. If you're lying down following surgery, make sure you sit for 1 minute before standing.
You can brush your teeth the next day after surgery, but rinse gently. 48 hours after surgery, you should begin rinsing at least 5 to 6 times a day, especially after eating. Use a cup of warm water mixed with a teaspoon of salt. Use the syringe that was given to you. The curved tip should be directed into the lower wisdom teeth sockets. Be gentle around the surgical sites. A dry socket is when the blood clot gets dislodged prematurely from the tooth socket. Symptoms of pain at the surgical site and even pain to the ear may occur 2 to 3 days following surgery. Please call our office if this occurs.
In some cases, discoloration of the skin follows swelling. The development of black, blue, green, or yellow discoloration is due to blood spreading beneath the tissues. This is a normal post-operative occurrence, which may occur 2 to 3 days post-operatively. Moist heat applied to the area may speed up the removal of discoloration. If numbness of the lip, chin, or tongue occurs, there is no cause for alarm. As stated before surgery, this is usually temporary in nature. You should be aware that if your lip or tongue is numb, you could bite it and not feel the sensation. So be careful. Call Dr. Olawoye if you have any questions. Slight elevation in temperature immediately following surgery is not uncommon. If the temperature persists, notify the office. Tylenol or ibuprofen should be taken to reduce the fever. You should be careful going from the lying down position to standing. Taking pain medications can make you dizzy. You could get lightheaded when you stand up suddenly. Before standing up, you should sit for 1 minute and then get up. Occasionally, patients may feel hard projections in the mouth with their tongue. They are not roots. They are the bony walls which supported the tooth. These projections usually smooth out spontaneously. If not, they can be removed by Dr. Olawoye. If the corners of your mouth are stretched, they may dry out and crack. Your lips should be kept moist with an ointment such as Vaseline. Sore throats and pain when swallowing are not uncommon. The muscles get swollen. The normal act of swallowing can then become painful. This will subside in 2 to 3 days. Stiffness or trismus of the jaw muscles may cause difficulty in opening your mouth for a few days following surgery. This is a normal post-operative event which will resolve in time.
If you have been placed on antibiotics, take the tablets or liquid as directed. Antibiotics will be given to help prevent infection. Discontinue antibiotic use in the event of a rash or other unfavorable reaction. Call our office if you have any questions. In the event of nausea and/or vomiting following surgery, do not take anything by mouth for at least an hour, including the prescribed medication. You can then sip on Coke, tea, or ginger ale. You should sip slowly over a 15-minute period. When the nausea subsides, you can begin taking solid foods and the prescribed medicine. Sutures that are placed may become dislodged. This is no cause for alarm. Just remove the suture from your mouth and discard it. The sutures will dissolve approximately 1 week after surgery. Sometimes they persist and can be removed in the office. The removal of sutures requires no anesthesia. It takes only a minute or so, and there's no discomfort associated with this procedure. The pain and swelling should subside more and more each day following surgery. If your post-operative pain or swelling worsens or unusual symptoms occur, call our office for instructions. There will be a cavity where the tooth was removed. The cavity will gradually, over the next month, fill in with the new tissue. In the meantime, the area should be kept clean, especially after meals, with salt water rinses or a toothbrush. Your case is individual. No two mouths are alike. Do not accept well-intended advice from friends. Discuss your problems with the persons best available to effectively help you. Dr. Olawoye.